This is a public health service announcement. August 1st is National Minority Organ Donor Day. Black people need organs. Here are some stats Dr. BCW and I would like to share with you right now. Stat number 1, the number of organ transplants performed on Black people in 2021 was less than 30% of the number of Black people currently waiting for a transplant. The number of transplants performed on white people was close to 50% of the number currently waiting. Stat number 2, in 2021, there were 33,000 Black people on the waiting list for an organ transplant. However, only 9% actually received that organ. Stat number 3, in the US, the average wait for Black patients who need an organ transplant is a year longer than for white patients.
So when you hear these statistics that we continue to hear over and over, and then we tie into the fact that we know Black people are dying at a disproportionately higher rate from kidney disease, it's multiple factors. They weren't able to get a kidney, they weren't diagnosed early. And then when you add in statistics such as in the United States, the most commonly transplanted organs are the kidney, the liver, the heart, lungs, pancreas, and intestines.
Yeah.
But on any given day, there are around 100,000 people on the active waiting list for organs. And when you look at the rate that you just shared, Eugene, of African Americans waiting, why do we have this gap? And, there are just so many different factors that are contributing to it. And then when you delve a little bit deeper and you look at two other important statistics, African Americans make up the largest group of minorities in need of an organ transplant. And as you mentioned, in 2021, non-Hispanic Blacks made up 12.1% of the national population.
Yep.
So when you put all of this together and then you look at communities of color, especially Black Americans being the largest group in need of organ transplants overall, why haven't we made steps into providing more access? Because the information's out there. We know what needs to happen. So why aren't we making those steps?
Absolutely. So we're thinking that the steps are pretty simple as far as progress and how we can actually achieve that. Because when we create these videos, we do not want this to be all about doom and gloom. We'd like to bring some level of solution so that we collectively as a community can work on trying to get from A to B to Z in a very productive and a very healthy way. So some of the things that we can do as a Black community, I'm going to throw a few more stats out there, and we'll kind of talk through some of the things that we can actually, ways that we can resolve this very, very important issue. There were only 2,500 Black organ donors in 2021, of which less than 500 were living donors. One of the things that we can do immediately is take better care of each other so that a diagnosis is made more quickly and we're able to get on the waiting list sooner. Let's also take better care of ourselves so that our organs are healthy enough to potentially extend a loved one's life. Remember, same race, it's not a mandatory, but the likelihood of success drastically increases, especially within the same family. The other thing that we can do, and this is another immediate for all of us, join the organ donor registry to give more Black people a second chance at life. And again, same race is not a requirement, but it does help due to blood type, tissue type, body size, body structure, etc. So please consider those two things, because those are two pretty simple steps we could take today in order to help save thousands of lives going into the second half of 2023 and into 2024.
And as you mentioned, race is not an eligibility piece, and it's important that we highlight that because there's all of these myths and things surrounding race and donation, and we have to really unpack that, because race, as Eugene and I have said multiple times, that's a social construct, and that is different than ethnicity and then your family history and so forth. So, those pieces are really important to look at, but also still highlight, yes, genetics, ethnicity, the more of a larger pool or access, that's how you can help save more people. And that's one part we are missing when you look at the African African American population. So, overall donation, there are so many contributing factors that are leading to the statistics that Eugene and I mentioned. And so, in closing, some of the key factors we want you to really take note of is there continues to be a lack of investment in health literacy that shares information of not only what organ donation is, but lifting the curtain behind the process. And I think if more organizations, healthcare systems took the time to share that information, that can help reduce, the mistrust, the concerns behind donation, which can lead to more people being willing to at least consider donating. So, we are just so grateful to come and share this information, especially when we talk about the need. There's so much need for us as a community to step up and provide organs. And it's important that I know it's not just about our community stepping up, it's also about the organizations stepping up and finding ways to socialize what is behind donating organs. What is the process? And invest in coming into our communities and highlighting why you're there, what we can do by donating. So it's a two-part process, but there definitely needs to be more investment in companies and organizations going into communities of color and really revamping how they socialize how important organ donation is.
Absolutely, Dr. BCW. It's time for us to hold these organizations accountable and responsible for the well-being of all people. And that includes Black and brown people. So public service announcement has now been concluded. Thank you for listening. Enjoy the last few weeks of summer. And as always, be healthy, be better, and live better together. Thank you.
Thank you.